Hello, friends, and welcome to another episode of the Concussion Nerds podcast. And today I'm coming to you from Spain. So you may or may not know, if you follow me on social, that I had the honor to speak at the World Orthopedic Conference and Physical Medicine Conference this last week in Madrid, Spain. And this podcast episode, I'm going to just summarize super quick what I talked about, and then it's going to feed into some shares that my community from social media shared with me when I asked a question. And I think that it's actually in beautiful alignment with the whole talk that I did in Spain, because it's all about awareness. Now, in Madrid, I was speaking to predominantly the orthopedic world, both physical therapists, physiatrists, orthopedic surgeons. And so what I was really pushing for and advocating in my talk was the need for better screening processes in place for individuals when they are seen in an emergency department or orthopedic practice or a general practitioner's office after the orthopedic trauma or an urgency is completed. Because what happens so often, and that so many of you have shared with me, is the concussion diagnosis was missed, right? And when we look at two of the leading causes of concussions. Remember, we have multiple reasons why concussions can happen, but the two leading causes of concussion and the biggest growth in terms of the number of concussions in an area we're seeing are coming from motor vehicle accidents and falls. And in both of those scenarios, there's a high potential of a corresponding orthopedic injury as well. And so in the medical system, probably one of the first touch points someone's going to have is either the emergency department or their physician or someone in the orthopedic practice because of a muscle strain or sprain or fracture or something more serious. And so my big highlight was in these scenarios, there needs to be processes in place to help diagnose that concussion as well. And I said to this group, I said, you don't need to know how to treat it. We just need to know how to recognize it, diagnose it, and refer to the people who can then do deeper assessment to build the individualized integrative treatment plan. So I had 20 minutes. That was what my 20-minute talk was all about in Madrid. And then I'm in the process right now of prepping a different workshop that I have to teach. And I went to my social media group because you guys are, those that listen to the podcast, many of you follow me on social. You are a wealth of information. And if you didn't know and you're not already signed up for clinicians or individuals on a journey, we have our Concussion Nerds virtual summit next weekend, like this weekend coming, September 21st and 22nd. And this summit is for clinicians and those on a healing journey. We have two different tracks. And it too is meant to help bring awareness around different topics of concussion. And so I have all of these things coming up, and I love to be an advocate for your voice if you're on a journey. And so I put a poll out, right? I love polls. I asked the community, I said, if you could share one thing that you wish your provider would have known, or you wish your provider would have taken into account, or I wish your provider would have done when working with you, what would that be? And I got a plethora of responses. And I want to share some of those with you for two reasons. One, as a clinician listening to this, our clients get to be our teachers. And I don't necessarily mean in teaching us how to diagnose concussion and how to treat concussion, but they get to be our teachers in reflecting back to us the experience that they've had in our care so that we can be better. I remember once I got a letter from a client. And I love what I do and I'm insanely passionate. And sometimes we all make mistakes and we don't follow through. And there was this time where I really, full disclosure, I sucked at it. And a client wrote me a letter. And I still have a fabulous relationship with this person today. She's a phenomenal human. And she told me after how hard writing that letter was for her. But she shared her frustration with me in how I was showing up for her. And it made me stop in my tracks. I replied to her letter after and just said, thank you. I apologized for how the experience we had made her feel, because that was obviously never my intention. And I thanked her for sending me that and for sharing her thoughts thoughts and feelings. And I think too often when somebody gives us feedback like that, we can get defensive. We don't want to hear it because it's hard to hear, right? When we fuck up, when we miss something, when we don't make someone feel the way we hope to make someone feel, that sucks. And sometimes we don't realize, and I'm not saying it excuses it, but sometimes we don't realize some of the actions or some of the words we're saying. And so for somebody to take the time to write that hard letter to me, to send it to me, really truly made me stop in my tracks. It was not easy to read. It punched me in the gut a little bit because I hate when anyone feels, but I thanked her after. And so I'm going to share some of this feedback that individuals on a healing journey have shared through social because I think that we can learn from it, all of us. And so the question was, what could your clinician have done differently? Or what do you wish your clinician had done differently to support you or guide you in this healing journey? So I'm just going to share some of these. I wish someone explained to me what I can expect. I was thinking I was losing my mind. This one, so prevalent, right? I think sometimes we forget, especially when we work in this space, that not everyone understands concussion the way you do. And when someone, particularly in those acute stages, when things aren't recovering at the rate that they are told they should, or no one's actually explained to them how a concussion can impact your life in the different domains of concussion, although it makes sense to us as clinicians why there's cognitive issues, why there's word finding issues, why there's memory issues, why there's balance issues, why there's dizzy, that all makes sense to us. But for someone who doesn't understand that, it can be terrifying as heck, and they can feel like they're losing their mind. So true due diligence in that first appointment. So both for me in a first acute appointment or a first persistent appointment, it is education. Because if we can educate and empower with knowledge, it helps calm anxieties and fears, which can also help support the recovery. So I hope we are all doing that. Number 2, how vision can be impacted. Yes. Oh my goodness. Yes. And we have Dr. Cameron McCrodin coming to speak on the summit all about vision after concussion. We have another episode as well that's about vision after concussion on the pod, and that prism glasses and neurooptometry and vision therapy exist. Yes, yes, yes. So again, that is our neurooptometrist, Dr. Cameron McCrodin, is going to be speaking at the summit about all of that, if that is an area that interests you. Oh, there's a study that looked at some of the things as a therapist we can do to instill safety and trust in building relationships with a client. So overall, there's the overall experience, there is the languaging, but how you prepare yourself as a clinician going into an appointment, going into a session was one of the biggest things. And what do I mean by that? How do you prepare yourself? Are you rushed? Are you like harried and frantic? Or have you taken a moment, you've taken a breath, you're calm, you're grounded, and you're calmly walking into a treatment room as opposed to coming in like the Tasmanian devil? Because this comment, the awareness this client wishes their therapists would have is that their energy, voice, and quick movement can be overwhelming. We can be overwhelming to our patient and to our client. If we are not being aware, if we're not paying attention to their responses and their reactions, right, we can be a source of the overwhelm if we're not careful. That symptoms are real and that it can impact every part of our life. A big piece of what I talked about in Madrid was that as clinicians, we tend to think of the symptom, right? We think that someone is having dizziness. We think that someone is having headaches. We think that someone is having blurred vision. And we think about the symptom, but we neglect to take that step across the bridge to how that impacts somebody's life. How the fact that they're having all these symptoms and they can't keep thoughts impacts how they can show up in their relationships. So their relationships suffer. How they can't work the way they used to work. So that impacts their ability to financially provide for themselves or their families. How usually their way of relieving stress to help them stay more regulated, they currently can't do anymore because it makes them feel like garbage and they don't have their usual outlet. So how are they regulating their own nervous system to best their ability when the tools they used to have been ripped away from them? We need to, as clinicians, take that step and walk across that bridge more often to remember we're not dealing with a symptom, we're dealing with a human. And a human's entire life has been impacted by this injury. The importance of multidisciplinary approach, treating all the affected areas, right? So we teach webinars on the integrated approach to rehab. We're going to be teaching another one in my own talk in the summit is the integrated approach to rehab. And so we talk about this for sure. The acknowledgement that whiplash can have lasting effects. Yes, absolutely. Whiplash can last. And the knowledge that so many symptoms from the neck can mimic so many different concussion symptoms. So we cannot forget about the neck. Let's see. Let's drop a few more for this is going to be a little short and sweet episode for you guys today. The frustration that the practitioner actually didn't know how to help, and that everywhere this person went, old school concussion treatments was what was being taught and preached and implicated. That this is something they are allowed to take seriously, and you're not just brushing them off. That just because you've seen one provider and are still struggling doesn't mean that that's it. They're still seeking help and support because they know that they can get better. I wish they knew about the tempo of building up treatment, especially when it comes to neurofatigue and pacing, right? How do we start to stack things? How do we implement our treatment in a way that supports our client in their life and doesn't crash them into the ground? And then I am going to say there were several comments sent in about recognizing that they might not know everything about concussion instead of gaslighting me, about taking me seriously, about how we're not lazy and this is truly impacting us. To everyone who sent in a comment, thank you. Those of you listening, those are just some of the comments that came through from people in this community who've been going through concussion rehab on a healing journey. All of those individuals, most of them, are in persistent care or on the persistent path. We know concussion can take weeks to years, but when we're pushing into that persistent stage, if you listen to the recent podcast interview I did with Christabel Braden, it's never just one thing anymore. We really do need to look at the entire person, both from a physiological standpoint, a lifestyle standpoint, and a psychology standpoint. From a physiological standpoint, that's where therapists like me and like other physical therapists and chiropractors and some osteopaths and some naturopaths, that's where we all come into play, right? Where we look at the multi-system integrated approach from a physiological standpoint of what's working well in our brain and our body, what's not working well, and how are things playing together nicely and not playing together nicely. And then we build our rehab interventions from there for that aspect. We have to look at lifestyle, right? We have to look at sleep. We have to look at nutrition. We have to look at movement. We have to look at outlets that you have for support for yourself, for your own nervous system regulation. We have to look at your own tools and your community and all these pieces. That has to be explored because it can be such a game changer. And then we have to look at the psychology. We have to look at mindset. We have to look at what are the words we're saying to ourselves? What are the words we're saying to ourselves, and how is that affecting our actions and our behaviors? How is our mindset around things? Again, going back to this is kind of like, but what are our tools to help us feel and explore grief and joy? Are we moving through the emotions? Is there past trauma we have to move through and resolve? Or because of this concussion, has new trauma happened that we need to face? Do we need to move through grief and anger to begin to reach acknowledgement so that we can begin to move forward? You can appreciate how in a persistent stage, all of these pieces need to be explored. And they cannot be explored by one person. This is truly where we need a team. And so I'm going to kick it back over to the summit, September 21st and 22nd, because we have clinical counselors coming to speak. We have physical therapists speaking. We have naturopaths speaking. We have chiropractors speaking. We have talks on the nervous system. We have talks on eye movement. We have talks on dizziness. We have talks on mold and its impact on the nervous system. We have talks on trauma, EMDR, and brain spotting. We have talks on yoga. And then from a physical therapy side, we have talks on the business aspect of things and building a brand and those sorts of pieces. There's so much here. And because y'all hear me preach about the different tools that have helped me on my own journey, like breath work, sound healing, somatic therapy, we have live workshops for each of those 3 as well throughout the week. Everything will be recorded, so if you can't attend us live, that's okay. I just wanted to jump on and say hello all the way from Madrid and just share really this episode. It's just about awareness. Awareness of what my goal was in coming to this conference to share with an orthopedic sector on how we can do better in the concussion space. And awareness for us as clinicians as a whole, sharing the words from this community on some of their own experiences and things they wish we would know when we help the next person with concussion. So my friends, until next week, actually, until this weekend, because if you're coming to the summit, you're going to start it off live with me Saturday morning at 9 a.m. Pacific. So until this weekend, or until the next time, have a wonderful day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.